Hello, thank you for joining me in this educational series called Get Back to Life with Reflex. I'm your host, Dr. Russ Riggs, the medical director at the Reflex Knee Clinic in Portland, Oregon. This is an educational series about knee health and how we can help improve our communities one knee at a time. All right, tonight we have a real treat, and that is to have Dr. Brad Simpson with us. Brad is a physical therapist. In fact, he's the director of the physical therapy department at the Reflex Knee Specialist Clinic. Brad, welcome tonight.
Thank you very much.
It's good to have you. So, what I'd like to kick off our discussion tonight with is looking at this baby boomer generation. I mean, they are active, they are on the move. They are wanting to travel, they're wanting to hike, they're wanting to keep up with their grandkids. I want to keep up with my grandkids. What can this generation do? What can we do to ensure that we stay active? Because you look around and some people, their activity levels just steadily decrease. Are there things, from your perspective, that we're able to do?
Sure. There's a lot that you can do. And one of the hard parts for the baby boomer population, they've been in the workforce for the last 30, 40, for some of them even longer amounts of years. And they do want to get back active again with their grandkids or go travel and hike. The problem of that is, ultimately, you need to be as fit as you need to be for as active as you want to be. And if you haven't been doing it for a while and then you want to go and do something, you're prone to getting an injury.
Kind of like the weekend warrior syndrome.
Yeah.
I haven't played basketball for 20 years and I'm going to go play a game and injure my shoulder or my knee.
Yeah, and a lot of your history ends up coming back that maybe you forgot about or you didn't really treat very well. You injured something, you left it alone, and it went away. But now that you're going to be getting a lot more active again, some of those things end up creeping back to becoming an issue, either in that area or now causing another problem for you. So one of the things that you can end up doing is being able to have a structured plan, just like going from a couch to 5K. You don't go from your couch to running a 5K if you haven't been running for a while. It's an 8-week, sometimes a 10-week progression to be able to get you there.
Makes sense.
Yeah, and even prior to that, having look at just how you move. Are you even ready to run? If you've been sitting at a desk for the last 30 years, running is a total different movement than sitting at a desk. So do you even have the ability, even though you can run, should you be running? And that's where having a movement analysis, being able to just have somebody take a step back and watch you and look at you and go through some functional movements that simulate the type of activity that you want to do to see if you even have the mobility to do that act, and then do you have the strength, do you have the endurance and the stability to then do that successfully? Because you want to be successful
that is
in what you do.
Such an important point, because in my own practice, I see people who come in and their spouse told them, "You're limping." They didn't even know, or a friend has to tell them.
Sure.
So over time, like you're saying, an old injury, it might even be an ankle sprain or a knee injury, something, or if I've got back pain, I'm going to move differently to try to avoid that pain. Mm-hmm. And if I start running or start increasing my activity after being sedentary for 30 years at my job, if I'm not moving properly, I can probably do damage to other areas.
Potentially, yeah. We're creatures of efficiency. We want things simple. So if it's not simple, we find another way. And that's where a lot of times your old injuries, like an ankle sprain, ankles are typically very healthy joints for the lifetime, unless you've had a history to it, and as much as just a single ankle sprain will give almost 100% of the time, some arthritic change over time from that sprain. And that will lead to a little bit of stiffness within that ankle that you may or may not even know. And the way you end up squatting, lunging, or getting towards fast walking, climbing up hills, or even descending big hikes, it requires that ankle mobility that you may not have now. And your body will then find another way to move in order to avoid that stiffness sensation, which then potentially can lead towards knee issues. For a lot of people, even something as little as a bunion, where my bunion doesn't hurt, but I'm starting to get low back pain. So the body tends to find another way, and a lot of times those other areas aren't able to accommodate for that over time.
And I imagine sometimes these changes are pretty subtle.
Mm-hmm.
Is it something that I'm going to notice, like, wow, my ankle's feeling stiff? Mm-hmm. Or is it something I may never be aware of until an expert does that analysis?
Sure. So if we were to look at the knee, for example, as little as 2 degrees of difference side to side. And for the majority of the population, they have hyperextension in their knees. The average man has 5 degrees, the average woman has 6 degrees of hyperextension. If you're missing more than 2 degrees on that one side from maybe a little bit of an arthritic change as you're getting older, or you had a previous injury within the knee, that you favored for a little bit and that knee just got a little bit stiff, over a 10-year span, your function on that side is about 80%. And this is looking at very large studies.
Wow.
So a little bit can go a really long ways in shifting you away from that stiffness. Will decondition that entire side, potentially lead towards other issues within the body of low back pain, or it stiffens up the hip, or stiffens up the ankle, weakens that side as well. And we live in a double-legged world. So if we end up having a little bit of weakness now on one side and trying to function within this double-legged world, it can become a problem. So yeah, a lot of times you have no idea because your body's just found that other way of moving.
So you end up having a limp and someone else has to point it out to you sometimes. Mm-hmm. So physical therapy, I believe, everyone can benefit from, because if it's a skilled physical therapist, the goal is to help me move better, make sure I'm moving properly so I'm not going to injure or damage other areas. How often should someone, even if I'm not having any pain, do you think I can still benefit by being evaluated?
Sure. And one of the problems that we've kind of had within our healthcare system is you have to have a problem to then get help. Instead of getting a wellness check in order to just see, how am I doing? I don't feel like I have a problem. How am I doing? And being able to get a movement analysis, or just have a long sit down with somebody to talk about general health. The problems sometimes of what we end up seeing in the clinic, we'll have somebody come in saying, 7 days ago I started having acute low back pain. Yeah, and so I've only had 1 week of low back pain. It should take a week for it to go away, right? Quick on, quick go away. But a lot of times it's not that simple. I try to tell people we have a lot of cumulative micro trauma that the body finds other ways and finds survival mechanisms to not have to think about it. But our bodies have sometimes this cumulative microtrauma that leads towards an acute exacerbation. So that onset has been coming on and coming on and coming on. The body's been trying to protect it and protect it and protect it until it just can't anymore, and it has an acute exacerbation. So now when we see these people with very acute pain that they want that quick fix, it's not quite that simple. It's going to take a long time to truly get better. That doesn't mean that it won't probably take a short amount of time for the pain episode to go away. The body has a way of kind of getting through these pain cycles. But the problem that brought on that acute exacerbation, that over time just takes longer and longer now to really get better again.
Yeah, what you're talking about is such an important concept, and I see so many patients who come in with acute knee pain, acute swelling, and they said, all I did was step out of my car, or all I did was step down one step on the same stairs I've been going down. And what they don't realize is it's been accumulating. There's either been weakness in a tendon or a ligament or in an area of cartilage that has held up with these micro traumas, but then there's an unmasking an event or an acute, all of a sudden I have pain. And they do expect that to be something that's fixable. And lots of times it will over time, but it's not always the quick fix we're hoping for.
Yeah, that stepping off a curb and my knee buckles on me is a common one. I mean, I bet the majority of the people even watching this can say, you know, I've sneezed and my neck kinked, you know, where I got a kinked neck from sneezing, or I've been over to tie my shoe.
My back went out.
Goes out. Yeah, or I sneezed and my back goes out. Sneezing's not the problem. Bending over to tie your shoe is not a problem. We should be able to bend over to tie a shoe. But the body just had a tipping point. So there was likely a vulnerability that the body just couldn't protect against anymore. The shoulder has the same thing. You know, there's a normal aging to the shoulder, normal wear and tear to the tendons through there, not a great blood supply to those tendons. That kind of lessens over time. And unless you're actively working to maintain the mobility of your rib cage and thoracic spine and good strength and stability of your shoulder blade and enough mobility of your neck. I mean, it's a hard area to manage. Unless you're doing that, you know, that shoulder over time, you know, as well as the stiffness of our bodies over time, just as we start to get a little more kyphotic, just makes that shoulder vulnerable where it's not a problem till it's a problem.
You know, this conversation is reminding me of something my grandmother used to say all the time, and that is, an ounce of prevention is worth a pound of cure. And unfortunately, it doesn't seem our healthcare system got that memo or has incorporated that wisdom into our current medical paradigm, where prevention is so undervalued. Because everything you're saying, to me, sounds like problems can be identified before they're a problem. But the way our system is set up is you have to wait until you sneeze and have back pain, or wait until you bend over and now my back went out before I go seek any attention. I can't just come see you and say, hey, I want to prevent my back from going out, or my neck from going out, or my knee from going out. Do you think the way I look at it is it might even be a good investment, even if, will insurance companies cover even if it is for prevention, if I'm not having acute pain? Or do I have to wait for acute pain before insurance will cover those services?
Typically, the insurance won't. But there's a lot of evidence around employers who end up having these kind of wellness programs within their company. We know it decreases injuries in the workplace. It increases job satisfaction, so your happiness overall increases. As well as even productivity within the workplace, by actually getting yourself out of work a little bit to wellness yourself by walking around and taking breaks. You know, working less actually will increase productivity to an extent, you know, with that. And
so it sounds like the corporate America is coming to realize this before kind of the medical establishment. I mean, I know you and I were really focused on preventive care. I know I am as an individual and in my practice. But most providers out there, it's just, what's your problem? What can we do now?
And there's also a lot of evidence around booster sessions. So after, say, a total knee replacement, and you've gotten through a pretty solid plan of care of normalizing motion and improving strength and function, within people, and you've gotten to that discharge point of 2 months later, 3 months later, or even a year later, being able to come in and just have kind of a recheck. How are you now? What are you doing now? How well have you maintained your mobility? Those types of questions go a really long ways to minimize problems down the long road. And it's been a cost saving. I believe it's shown cost saving ways within healthcare, as well as improved outcomes with patients, like longer outcomes that are positive after these replacements.
Makes total sense.
Yeah, so we know it within that realm, but healthcare hasn't really gotten to it as just a straight wellness.
As a physical therapist, what are some of the most important things you feel you can help people do? Back to our very first, discussion point. I want to be active. I know everyone out there wants to be active. Sure. What can we do? After this discussion, I think I'm going to come see you, make an appointment, and even though I'm not having any pain, I would gladly pay out of pocket, because I view health as an investment, not as something I wait for problems to crop up. Do you feel like that's a good strategy, or is that a waste of time, or what have you seen in your 17 years of practice, did you say?
Yeah, so a good way of thinking about it is time is always our best friend if it's spent the right way. And you don't necessarily know what that way is without having a real plan and knowing what that plan is looking to attack. And
so the plan shouldn't be just wait till you have pain and then deal with it then?
Yeah, or just I'm gonna go walk, or I'm gonna go hike. Depending on your history of injuries and how you responded to those and what you did to recover from those past histories. Most of us have gotten injured. Most of us have strained a hamstring or sprained your ankle. And most of us, if you were to really ask, what did you do? I booted it for 4 weeks, and then I just went and lived after that. I left my hamstring alone, and
it got better.
And it went away.
Yes.
Yeah, it got better. And we know that that's not how soft tissue heals. Soft tissue scars. And that scar has high amounts of nociception, or nerve fibers around them, which is why it hurts when you touch it, kind of thing. The body does that as a protective mechanism, part of just our evolution. And it doesn't just turn into the normal tissue after that. The body will lay down healthy tissue along lines of stress, which means you got to retrain it. You got to rebuild it. You have to break down that scar to rebuild it. And that takes time. And so depending on what you're coming to me with or without pain, depending on what your history is, there's a prognostic time frame to that. And it's not you coming to me 2 times a week for 4 weeks. And I try to address that from the very beginning with people when they start telling me this history, and I start peeling back these onion layers of them. I tried to get to this as early as possible of saying, this is going to take time. And I want you to understand that.
What would you say the average time frame is? What's a realistic, I know what patients want. They want, see me one day and I want to be better the next. But everything you're saying as far as reconditioning, making sure we are moving properly, that we're strengthening the right muscles, stretching other muscles, making sure our movement is symmetric and fluid. How long would you say the average kind of time cycle is to when I leave, instead of just going back to more micro trauma and waiting for another acute exacerbation, to actually have a sustainable, long-term, no revisit to that acute pain episode?
Most people that, when they come in, they're not even moving well. And they may not even realize it. But when it comes to the knee, if they're missing more than a couple degrees of knee extension, they likely shift in the way they stand onto their other limb, which is going to stiffen up the hips, stiffen up the ankles, stiffen up that knee more, shift the low back. And so
there's a lot to work on.
There's a lot, there's a lot to work on just to be symmetrical, more side to side. So you can then work on strengthening. Once you hit the strengthening phase, if you're looking to grow bulk, you're looking at 4 to 6 weeks just for the hypertrophy to really begin within the musculature. And then it's going to take more time than that of just continual, 3 times a week, loading that tissue to a pretty moderate amount where it gets a little sore, gets a little uncomfortable, to continue that build to get equal side to side. And then once the strength is getting near symmetrical, after working on just getting you moving well first, then we work on your function. So if you have that goal of playing softball or getting into your recreational whatever, there's
pickleball is big these days.
there's the training on top of that. So phase 1 is your mobility. Phase 2 is isolated strengthening, get symmetrical side to side, and then we can work on your function. So as far as time frames, I'd say it depends. If we were to look at averages, probably around that 90 days, a few months, but then that doesn't mean that you're seeing me twice a week for 90 days. As we get into the strengthening, as you get into being able to manage your condition well between visits, which includes potentially having setbacks in between visits, which isn't a bad thing. You're going to have setbacks along the way, but you're able to manage it well, meaning you have a plan when those setbacks happen. You're not going to be seeking opioids or going to the ER and getting more imaging or having the fear for I need surgery now or I need that fixed, but realizing this is part of the process. So when you start having that ability, then we start to really space it out and let time, which is our best friend if it's spent the right way, positive way, is going to be really our best friend. And so it shouldn't be a short game. Controlling the pain is usually really easy. And this is why, for me, I have this conversation with you likely day one of just saying, give me time. Give yourself time. Don't get scared. You're going to be okay. And realize this is a process that isn't linear to get you to the top, but it's an up and down. And a lot of times your exacerbations or your what you call a regression is only because you've had a progression. Now you're getting less fearful. You're getting more confident and comfortable. And so you're pushing the envelope and you find a new wall. And you're like, gosh, dang it. My knees swelled up some again, or I feel stiff again. It's okay. We know how to now get you back to where you were prior to that wall that you just hit.
Well, sounds like, as we know, at least in medicine and staying healthy, there are no shortcuts. Yeah. And when recovering from an injury, it sounds like we need to make sure we have a plan. And one thing that you said that was very interesting is a lot of therapists, it seems like, jump right into the strengthening. Yeah. And so you said the first step is movement, make sure we're moving properly. Does every therapist approach it with those the same kind of movement before strengthening, before function?
Sure. I would hope so, but no. It's not the fun part of therapy. The fun part is grabbing the weights and getting to a lot of the functional types of things. But you need to move well to be strong. You need to move well to be well. And as far as, I guess, to even go back to the certifications or the fellowship or people that go through residencies, one of the biggest things that having a lot of that continuing education has given me, and it gives anybody who goes through this stuff, a lot of mentorship. where you have a very skilled clinician sitting with you with your patients to be able to reflect how well you did or what things you need to improve on the next time, what things didn't you ask, to be able to learn the patient a little bit more. And through a lot of that reflection, you end up kind of learning, well, should have I been doing this strengthening? You know, this person's still kind of limping when they're coming in my clinic, and I'm having them do leg press machine or knee extension machine. When in all reality, they just need to learn how to stand and not compensate in the way they stand, or shift in the way they get up and down from sitting. There's a lot of people who have come in and they use the gym every day, and when I see them get up from sitting, they kind of pop off to their left side to avoid their chronic right knee. And good luck getting strong in something that when you get up and down 35 times a day, you're not even putting weight through there. You're going to get deconditioned through that side. So it's a moot point. So I try to make my progressions make sense, you know, and patients really understand that. When I educate them on that, they're like, huh, yeah, that makes sense. You know, nobody's ever really put it that way. But it's not rocket science. You know, I'm not doing anything really crazy. Yeah, one of my earliest mentoring times with one of my biggest mentors, you know, she said the best therapists do the simple stuff well. And all that is me learning the patient in front of me, trying to learn what has been trialed before that didn't work, and not do the same thing again, and try to just see where in this process is it just not getting better. You know, what isn't making sense to the patient, you know, of what they need to do in order to get on that positive path. Once you have that positive path, the plan is easy. It's easy to get stronger. You know, there's a lot of evidence around how to get stronger, and then there's a lot of evidence around very functional activities to improve your ability to do pickleball. You know, but the person that keeps coming back around that same vicious cycle, the last thing I'm going to do is just strengthen them and get them doing pickleball again. They tried that and it failed. So taking that little step back and trying to just see, what did we miss? And a lot of times it's things that are very silent, old history that you thought just got better because I left it alone and it should get better, is still there. And I got a client right now that has a very chronic quad tear. And when he came in to see me, it wasn't the quad that was a bother. He was getting gluteal pain, a lot of hamstring pain from those guys doing all the work because he didn't want to be using his quad. He learned how to find another way. And now that area is breaking down. But I can't just treat that area. You know, I got to find, why is that area taking all the force? And it's from that nice, quiet, chronic, weak, stiff, tight quad tear. Yeah.
It's been wonderful having this conversation with you. You know, having you and others like you in our community who can help us learn to move better, can help us prevent problems or identifying problems by the way I stand or by the way I rise from a chair, and preventing that from turning into a problem seems like the answer we all are looking for.
Yeah, and I would say to anybody out there, one of the biggest take-homes, I think, is, one, don't be scared of your problems, you know, but have a plan for them. So rather than being scared and anxious and apprehensive over your injury, nobody's ever died of knee pain. Nobody's ever died of hip pain.
They just want to some days.
Yeah, just realize you're going to be okay, but then find somebody that you trust and that hopefully has gone above and beyond to be able to understand these conditions, not just how to treat a hip, but how to treat the entire system, how to treat the body, and have a plan to be able to get you there. And then that's a very proactive approach towards your own health and management, instead of the reactive approach, which is our healthcare system of, I hurt, therefore I need. I'm doing well, how do I continue on this path of wellness?
Well, Brad, it's been a true pleasure having you here on the show this evening. Your expertise, your experience, I think a lot of people are going to benefit from. Thanks for teaching us more about how important prevention is in leading a healthy life moving forward, how important how we move is, and for being there for people like me who want to keep up with my grandkids, and I know there are a lot of other people out there who want the same thing. So physical therapy is something that everyone should consider. Find an expert and get a plan. Thanks again, Brad.
Thank you.
Well, that concludes this episode. Thank you so much for joining me, and I hope to see you on a future segment as we strive to improve the health in our communities one knee at a time.
Well, it's good to be alive. So good to be alive. This feeling's running high.